Hi, let us today discuss about the bone called patella. This patella is a sesamoid bone. Patella is a sesamoid bone which grows like a seed within the quadriceps muscle due to its repeated contraction. So within the quadriceps femoris muscle, it grows like a seed. Since it is a sesamoid bone, the word sesamoid is derived from Arabic, which means seed. So it grows like a seed due to the contraction of that particular muscle called quadriceps femoris. So this patella, since it is present in front of the knee joint, it is also called as kneecap. It is also called as kneecap. If you see the parts of it, it is somewhat triangular in shape like this. This is seen from the front, having a base above. This is a base above and somewhat pointed and directed downwards, and this is called as apex. And this one is the base. The base, which is wider, is above, and the pointed end, that is the apex, is directed below, and this one is the anterior surface. Okay. If you see from behind, this is the base. And this one is the apex. And it consists of two facets. This is a posterior surface which consists of two facets. One larger, these facets are formed by a faint ridge which is somewhat medial to the center. Thus, we have a larger lateral facet and a smaller medial facet. This is a medial facet and this one is a larger lateral facet. Again I repeat, it consists of base above. This is a base, this is apex, and this one is the anterior surface. So this diagram is the base, this is apex, and this is anterior surface. And it also consists of posterior surface. So this is the posterior surface, and the posterior surface is containing two facets. This is a larger lateral facet and this is a smaller medial facet. Is it clear? Now, for the side determination, identify the base and keep it above. Identify the apex and place it below. Identify the rough surface, which is anterior surface, which should be in front. Then the larger facet on the posterior surface should be lateral. The larger facet on the posterior surface should be lateral. Larger, which starts with letter L, and it is lateral, that is also ending with starting with letter L. Okay. So keeping these points into consideration, now I can say that this bone belongs to the right side because this facet is larger and this facet is smaller. And this is the base which is above, and this is apex which is below, and this is a posterior surface having two facets, larger facet and a smaller facet. This larger facet should be lateral. If I place it in the wrong side, thinking this as the left one, if I think this as the left side, this larger facet is becoming medial, which is wrong. The larger facet has to be lateral. For confirmation, you place it on the ground and it will fall onto the corresponding side. Since this is right side, it is not falling onto the left side, it is falling onto the right side, keeping all the base and apex in proper position. Then if you place it on the ground, it falls onto the corresponding side. So this belongs to the right side. It's clear now. Again I am saying this is a sesamoid bone. It is a bone formed within a muscle. It is a bone formed within a muscle, and the muscle is not inserted here. That muscle, which is a quadriceps femoris, finally is inserted into this tibial tuberosity. This is a tibia bone. Finally it is inserted into the tibial tuberosity through a ligament called ligamentum patellae. This quadriceps femoris finally is inserted into a ligament called is inserted into the tuberosity of the tibia through a ligament, and that ligament is called ligamentum patellae. Okay. Now coming to few attachments of it. Base, which is wider and it is above. Apex is directed below. To the apex is attached the ligamentum patellae. This one, it is the ligamentum patellae. And this anterior surface at the base, from before backwards, it gives attachment to muscle. Like this one is the rectus femoris. This is rectus femoris. Then we have vastus medialis. This is the vastus medialis. And this one is vastus lateralis. And here this is the vastus intermedius. Again I repeat, anteriorly at the base, from before backwards, from front to back, it is rectus femoris first, which is attached here, followed by vastus medialis, which extends along to this medial border and the lateral border. Like this is the medial border and this is lateral border. This vastus medialis extends along the medial border in its upper 2/3, and this lower part is limited by the medial patellar retinacula. Medial patellar retinacula. Similarly, this is vastus lateralis, which is transversely placed in its 2/3 just behind the vastus medialis, but it also extends along the lateral border in its upper 1/3 extent, and the remaining lateral border is related to lateral patellar retinacula. Okay. Then here we have vastus intermedius in the middle, and rectus femoris, it is more anteriorly placed. Rest of this anterior surface is showing some grooves like this. These grooves are meant for the attachment of some portions of this patellar retinacula as well as some fibers of the said muscle. Okay. So this is all about the anterior surface. Coming to the posterior surface here, posterior surface is having two facets. Already I have said this facet is larger facet, which should be lateral, and this is a medial facet. This articulates with the patellar articular surface of femur like this. See, if you see the patellar articular surface here, this is right-sided femur. This medial articular surface is smaller, where I am putting my finger. whereas this one which articulates with the lateral articular surface of patella, which is larger. So it is somewhat like this. It's clear? Okay. Then this posterior surface, this medial facet, there is again a vertical ridge, a thin faint ridge seen along the medial facet, thereby forming a medialmost area here. This medialmost area, this during deep flexion, during complete flexion of the knee, this medialmost portion comes in contact with the condyles of the femur. Is it clear? At this portion, the femur comes in contact with the patella. Similarly, two faint ridges or faint areas can be seen running transversely like this, thereby dividing it into upper part, middle portion and the lower portion. This lower portion comes in contact with this lower portion comes in contact with the femur during normal extension of the knee, and in semiflexion of the knee, this middle portion comes in contact with the femur, and in complete flexion of the knee, it is this upper portion which is comes in contact with that of the femur. This is only the areas on the patella at different positions of the knee, which part of the femur is coming in contact with what portion of the patella. Just to explain that, this lower part comes in contact with in extension, the middle part comes in contact with semiflexion, and the upper part comes in contact in full flexion. Okay, and this lower portion, this one is the apex, which gives attachment to ligamentum patellae, and through this ligamentum patellae it is finally inserted into the tibial tuberosity. This is in brief about the small bone called the patella. Is it clear? Now coming to its applied aspect, it forms an important part of the knee joint, and it forms an important extensor apparatus of the knee. It forms an important extensor apparatus of the knee. Then the patella is slightly displaced laterally, which can be appreciated only in the X-rays taken in skyline view. In the X-rays taken in skyline view, it can be appreciated that the patella is slightly tilted towards the lateral side. Next, patella can be fractured in multiple fractures of the patella, or even in patellectomy. When the patella is removed, it results in extensor lag. Which means although it is a part of the knee joint, in case of removal of the patella, when the patella is removed, in the sitting position, if you do slight extension, like complete extension of the knee cannot be done with ease, and that is called as extensor lag. When the patella is absent, when the patella is removed, it results in extensor lag. That means complete extension of the knee cannot be done. So it hampers complete extension of the knee. That is extensor lag. Now coming to this one, which is the vastus medialis muscle. This vastus medialis is phylogenetically is the last muscle to form, and it is the first muscle to undergo wasting in case of the diseases of the knee or the problems of the knee joint. In case of any problems of the knee joint, the vastus medialis is the first muscle to undergo wasting. And we can see the dislocation of the patella is always lateral side, because the vastus lateralis is stronger and the vastus medialis undergo wasting in the diseases of the patella or in the disorders of the patella. Hence the dislocation of the patella, because of this strong vastus lateralis that will pull the patella more towards the lateral side. Hence, the dislocation of the patella is always lateral. These are few small things, and even the ligamentum patellae can be used in eliciting the knee jerk, where the ligamentum patellae or the patellar tendon is used for eliciting the knee jerk. This is all about the small bone called the patella. Thank you.